Well, thank you to the committee that invited me here. Thank you to the chairs for the introduction. It's a pleasure to be back here. And I'm going to talk about pulmonary rehabilitation. And you'll be pleased to know I'm going to be showing a film, so it won't just be me talking. So the question to you is, what are we going to die of? We've been through some of this data, so I shan't go through it in great detail, but as you can see, COPD and lung diseases, which are highlighted here, are pretty high, and there is a rising burden. So the prevalence of COPD has increased by 35% in a 10-year period in Africa. COPD is not going away. And as I alluded to in my question, there's more to chronic lung disease than just COPD. Post-tuberculosis lung disease is 20% of the people, adults, who attend the outpatients in Milago Hospital, respiratory outpatients. The 20% of these people have a disease which doesn't really have a diagnosis, it doesn't have a label, it doesn't have any good definition, we don't know what the phenotypes are, and the management is completely unclear. But there is a group now formed which will look at post-TB lung disease, and it's really good we have a session here. And anyone who's going to the union, we have another post-TB lung session there. So how do you treat these diseases where the lung is permanently damaged, like with COPD, like with post-TB lung disease, or like in asthma where it's gone uncontrolled for too long? We'll come to that in a second. But let's consider a patient here. This is an MLI patient who's given consent for his photo to be used. He's got chronic lung disease. Do his problems arise because of his lungs? Yes, he's breathless. He's got symptoms, he's got exacerbations, which cause him respiratory symptoms. But what's holding him back is often anxiety, it's depression, it's social isolation, it's the fact that he's not exercising, so his muscles are becoming weak, and he may have a variety of comorbidities. These kind of lung disease don't come on their own. So these chronic lung diseases do not just affect the lungs. And actually what happens is you develop breathlessness, and then what do? You try and avoid it. Your behavior changes. So you become more inactive, and that makes you become weak and tired, and fatigue is probably one of the most major symptoms of chronic lung disease. And so associated with that, you get muscle wasting and increasing breathlessness because you're more tired and you're weaker. Also, anxiety and depression is associated with a number of things like social isolation and loss of income. And the stigma, which we've heard about from TB, is just as bad for COPD, and we have a lot of data on that. People get respiratory infections, which damages their quality of life and further increases the inflammation. And their inability to work creates a massive difficulty for these patients. So what do the guidelines say about how we treat them? Well, they say the best thing to do is give them a flu jab, tell them to stop smoking, and then pulmonary rehabilitation. This diagram shows what's the most cost-effective. So the most cost-effective things are on the bottom. I presented this slide in Kyrgyzstan, and I asked for comments, and the comment came back, it would be nice to have one of the things in the box. Okay, so here, these are the things which are most cost-effective, most valuable, and actually they're not really here, so I'm going to talk about pulmonary rehab. The drugs will not address the systemic problems which patients feel. So what is pulmonary rehabilitation? It's a program of exercise and education. It's for people to get them participating in life again, getting them fitter, getting them more active. And each patient has an individualized regime, and it's usually done in groups. And is known to improve symptoms, mood and motivation, improves independence and participation. And the rehab program which we use is evidence-based and is for twice weekly for 6 weeks and involves 2 hours per session. Well, this is 2 Ugandan hours. It takes slightly variable hours, shall we say. In fact, if people don't come up, the other patients call the patients who haven't arrived and say, "Where are you? Come now." And so we talk about exercise, how it's safe to exercise, because most of our patients think that exercise will damage them. And in fact, exercise is the one thing they have to do. The exercises are related to strength and endurance, and we have a physio who runs this program. And we teach them about what's wrong with their lungs. And this comes as a complete revelation. Most people have no idea what's the matter with them. We talk about how they can treat it themselves, how we can put the patient in charge of their own problems, whereas they feel a victim of a disease. We teach them how they can manage their own disease. And that's very empowering. So we can reduce the air pollution and smoking by teaching them to avoid those things. We can, that's indoor air pollution, we can change. Outdoor air pollution is more of a problem. We can reduce stigma, because when you go to a rehab program, you reduce the social isolation, people see you getting better, and then you don't get the same stigma. We get them back to work, and so they have money so they can afford food, and we get them more active and their muscles improve. So we reverse that vicious circle. So the evidence behind this is that it improves quality of life, exercise capacity, it can reduce mortality, and I suspect in Uganda the effect on mortality is huge. Because there is no safety net, because there are no social services, so if you lose money, you lose income. No one's going to bail you out. And so I think people die a lot with this quietly in the corners. It reduces hospital days and readmissions, and is very cost effective, as I've said. It's suitable for all chronic lung diseases, particularly where they're stable and not reversible, such as asthma. But why is it useful here? Because it uses the local resources. We use local staff. We don't need to buy in drugs or equipment for it. It's sustainable and scalable. And we do see some real good benefits in the worst affected patients. People for whom you can do nothing normally. So I'm going to show a film now.
In Africa, chronic lung disease has been found to be a major problem. It's usually a silent disease until it becomes very advanced. There are a variety of causes. A major cause is smoke from cooking fires and kerosene lamps. Also tobacco smoke and exposures at work contribute to low-grade persistent damage to the lungs. The damage is insidious and creeps up on the individual. Only when this damage is significant does the person get breathless, but by this stage, it can be too late to do much about it.
So, TB, smoke from cooking fires, and tobacco smoking all cause permanent lung damage.
As people with chronic lung disease become breathless, they tend to avoid exercise. Inactivity causes a decline in their fitness and strength.
This is a project where we try to get people who have chronic, permanent damage to their lungs and try to rehabilitate them through exercise, through general education about their condition.
Pulmonary rehabilitation is widely used in Western countries and has proven benefits in boosting quality of life, physical fitness, and the ability to carry out the activities of daily living. The program starts with a group warm-up exercise. There follows a series of individual exercises which the patients complete under the direction of the physiotherapist. The education section of the program was adapted to address the problems faced by people in Uganda.
I was feeling weak all the time. I could sleep. I could do nothing at home. I was just there. And I didn't know what to do. As I went through the program with them, I realized that it was real medicine to my health, so that I should keep on doing such exercises even at not here, when I'm at home. I feel stronger than before, and I feel that I can do those kind of work that I didn't do before. I can now stay longer hours at the place of work. I'm so happy, and I appreciate the directors of this program.
So the results from this program show great improvement in people's lives. There has been improvement in respiratory symptoms, cough, chest pain has reduced tremendously, and the distance these patients can walk after they have undergone the program is amazing. According to stories from patients, they describe them being given back their lives because of this program.